everyone. Thank you for joining us today for this important and exciting event. It is so wonderful to be here amongst healthcare champions and grassroots warriors. My name is Christina Shelton, and I am the 90th Assembly Representative in Green Bay, Wisconsin, and my pronouns are she, hers. First, I want to thank Citizen Action for hosting this event and for inviting me and our distinguished guests to speak. This is truly one of the greatest fights of our lives. And before we begin, I want to start with an affirmation. Healthcare is a human right. Healthcare is a right because without our health, we have nothing. Healthcare is a human right because it's not just about our own well-being. It's about the well-being of our family, of our neighbors, and of our community. Healthcare is about recognizing the connectedness that we all share with one another. And we are here because we believe that every single Wisconsin resident, no matter the color of our skin or how much money they have in their pocket, everyone deserves access to quality, affordable healthcare. Here in Wisconsin, we come together to take care of one another. And the governor's budget is our chance to make sure that our government steps up during a time of great need. So today's event is a kickoff to a statewide week of action led by Citizen Action members to expand Badger Care, to create an Office of Prescription Drug Affordability, and to address the long-term caregiving crisis. Across the state, from Green Bay to Eau Claire, to Milwaukee to Wausau, members from across the state will be meeting with their elected officials and urging them to support and pass these life-saving health equity elements of the governor's budget. It is long past due that Wisconsin expanded Badger Care. And now with President Biden's American Rescue passed, our state, as it is proposed in the governor's budget, stands to receive $1 billion. I'm going to say that again, $1 billion if we expand Badger Care. So today we're coming together as friends, as colleagues, as advocates, as legislators, as supporters to expand Badger Care, so that everyone across Wisconsin can get the best care they need at every stage of life, and so that we can all see a doctor, not just when we're sick, but as preventative care too. It's something we all deserve. And now I'm privileged to introduce my friend, Dr. Kristen Byerly.
Thank you so much, Representative Shelton. And I just have to say, the people of Green Bay and Northeast Wisconsin knew how much we needed your voice in the legislature. Your words and your actions right out of the starting gate have shown us every day how right we were. So thank you for the kind introduction and just for doing what you do every day. We are all here together today with this outstanding and diverse panel of experts sharing different but equally important perspectives in support of the healthcare elements in the governor's budget. I personally am an obstetrician gynecologist. I'm a physician. I hear these stories every day. I take care of moms and babies and families, women of all ages, sometimes even men. And it's a wonderful job. I get to bring life into the world. I get to help people navigate some of the most intimate and devastating challenges that they will ever encounter. Diagnosing cancer, navigating a worrisome bleeding problem or pain or depression, these are all really difficult personal experiences. But the most frustrating scenarios that I encounter are the problems that we can fix, the win-wins, like Badger Care expansion and the public option, things that should be easy wins in the governor's budget, things that are stymied by ugly partisanship and divisiveness, things that destroy lives and tear families and communities apart. So let me tell you some stories. I want to tell you about my friend Beth. She and her husband have health insurance, so they thought they were covered. And it wasn't until months after their son James was born that they recognized how, despite their good coverage, financially things looked pretty dire. And then the pandemic hit. So her hours were reduced. He lost his job. They couldn't afford minimum monthly payments to the hospital, and they had to put their bill on a credit card. My friends Carrie and Brian have a similar story. As young, employed, insured parents, they had to pay thousands of dollars out of pocket several years in a row when their HSA ran out in the middle of the year. While they were able to pay for their healthcare expenses, they weren't able to pay for other essential things that ended up on, you guessed it, their credit card. Their son is starting college this fall, and they are still paying off the debt that began with his birth 18 years ago. Worse, my neighbor Mary needed an imaging study. She's a healthcare professional, and she knows that 1 in 8 women will be diagnosed with breast cancer during her lifetime. 1 in 8 women. This was important, but she didn't get it because she knew she couldn't afford it. Carly did get the testing she needed, which was an MRI every year, a mammogram, and ultrasounds because she had suspicious lesions and they were worried about cancer. But it would take her a year to pay for them just in time for the next round of testing. Carly, though, was lucky. She could pay for it. Liz can't. She has the cancer gene, and her story is not ending well. And last but not least, let's not forget about Lori. She's recently divorced, 28 years of marriage. He always had the health insurance. She barely qualified for Badger Care, and now she has to make less than $1,400 a month to keep it. She thinks she's going to lose it soon, and she knows that the premiums for someone her age, it's about as expensive as owning a luxury car, and she can't afford that. So what should she do? I could go on and on. It's story after story every single day. I want to invite you to ask someone, a friend, a neighbor, a sister, a brother, and then just listen to what they have to say to you. Nearly everyone has a story that illustrates the desperate need we have to expand healthcare access and accessibility. So now I want to turn it over to Renee Gash, member of the Citizen Action Northeast Organizing Co-op. And just to let you know, Renee is a freelance writer. She's an educator. She's an organizer. She's a social justice champion. But amongst all these wonderful things, I'm most proud to call her my friend. Renee.
Thank you so much, Dr. Lyerly, for that very gracious introduction. My name is Renee Gash. I use the she, her pronouns. I live in De Pere, where I'm a freelance writer, and neither my husband or I receive health insurance from our employers. So we purchase off healthcare.gov. And when my husband and I were both working before the pandemic, we paid about $1,300 a month to purchase health insurance off the marketplace, and another $13,000 a year in deductibles. It was a huge expense, but I am so grateful to have had that health insurance in 2018 when I was diagnosed with thyroid cancer. These last 2 years have been filled with tests and treatments and medical bills. And I appreciate the security of knowing that the Affordable Care Act was there to protect me through my health journey, just as it does for millions of people like me with pre-existing health conditions. And from now on, I will forever have to budget for prescription drugs and cancer screenings. And I think Wisconsin can do more to help people like me afford our healthcare costs. We all deserve the opportunity to live, thrive, and contribute to our community. And our communities prosper when its residents are healthy and well. So I believe in my heart that improving our healthcare system should be a high priority. First, I want more affordable healthcare option on the marketplace. The proposal in Governor Evers' budget to add an affordable public healthcare option for Wisconsinites to buy into Badger Care would benefit my family hugely. In addition, people deserve the dignity of knowing they can afford the medicine they need to survive. The governor's proposal to launch an office to review prescription drug pricing is the type of protection health consumers like myself need. And finally, taking the Medicare expansion in the ACA is long overdue. We can dramatically improve the well-being of our communities if more low-income people have access to preventative health care. We are in a period of great healing from what has been a very difficult pandemic. This past year has shown us how important healthcare is to our personal and collective well-being. And this is the time to heal our healthcare system too. I hope our lawmakers will stand with families like mine in Wisconsin and pass a budget to provide us more freedoms and more choice in meeting our healthcare needs. So thank you so much for taking your time and attention to this issue. And it is my privilege and pleasure to introduce next Representative Lee Snodgrass, Assemblywoman for the 57th District in Appleton. Thank you, Lee.
Thank you so much, Renee. I appreciate everybody's words so far, and I want to reiterate that sometimes we don't understand the face of poverty and who might be impacted by the ability to expand Badger Care. I have been a single parent for over a decade now, and it's sometimes hard for people to realize that my story is actually one of those stories of people who have had to make choices in the past between their bank account and their health care. And nobody should have to make that choice. Nobody should have to go to the doctor, receive test results that say, we'd like to take a closer look at some things, but then knowing that taking that closer look is going to be something that you might not be able to afford, as Dr. Lyerly said, without putting it on a credit card. We should never have to make that difficult choice. When I was running for state senate in 2018, the story was no different. I knocked doors every day where people told me stories about sharing medication with their spouse, cutting pills in half, or taking second jobs to afford medication for their children, simply because the costs were just too hard for them to accept on their own and on their salary. It's no different now, but what is different now is that we have seen the vital link between employment and healthcare. When we had the pandemic hit and we had record unemployment in our state, and people realized that their healthcare being tied to their employment was not a place of security, but a place of great stress and strain, we realize even more the opportunities that we have by taking this expansion and by making sure that there's a public option in Wisconsin, as the governor has in his budget. A lot of people also don't understand what it means when you expand it to 138% of the poverty level. In my district alone, the 57th, which includes Appleton and Menasha, this would impact 2,000 people. That's a lot of families who right now are making those difficult choices between their bank accounts, between their financial security, and between their health. This is the United States of America. We should never have to choose from our well-being and what something costs. We have an opportunity right now. We've seen there was a recent article in the Milwaukee Journal Sentinel about what Wisconsin is leaving on the table. Governor Walker, when he was governor, said that he did not believe the government would reimburse to the 90% rate. He did not trust it. At this point, what Wisconsin is doing is getting about 58% reimbursement, and we're essentially paying for the expansion ourselves. Even Republican-led states realize that this is fiscally responsible, if not morally responsible, and have expanded Medicaid. It's far past time for Wisconsin to do it. The silver lining of this pandemic has shown us how important healthcare is to us all and how we're all impacted. And I am really excited to introduce somebody who has been a champion on this issue, as well as many issues on equity and justice, our very own Lieutenant Governor Mandela Barnes.
Well, thank you so much for the kind introduction. I am so honored to be joined by such an amazing group of leaders, people I've had a chance to work with, and also Citizen Action. I remember the fights that we've been involved in since I was in the state assembly, taking on the former governor to try to expand Badger Care here in the state of Wisconsin. But now I'm so proud to be a part of an administration that takes healthcare seriously. But we can't do anything without leaders like Representative Shelton, Representative Snodgrass, and the Assembly fighting hard every day against their colleagues, many of whom still don't seem to get it. But we know that better is possible because this is not a partisan issue. We know that Democrats and Republicans alike all over the state of Wisconsin, unfortunately, have some sort of healthcare story to tell, especially given the immense challenges that we faced over the last year. So also want to thank Dr. Lyerly, want to thank Renee for being a part of this as well, because we have work to do. But I'm excited to be a part of this work. We have released a budget that we can be proud of. And the unfortunate reality is that there are too many children and families in our state who haven't had the access to quality and affordable health care that they deserve. This is an issue, like I said, that's been going on for far too long. And people have taken some action, but there's still so much work for us to do to close the gaps. And we know that personally, like I said, this has been an issue for me. I had a healthcare story at some point in my life. But as I mentioned before, the last year has made it undeniably clear how important healthcare is to all of us. We see our doctors, nurses, and healthcare professionals who've made incredible sacrifice. And we've also been forced to recognize how an untreated medical condition could become a life or death situation, or it could potentially become an issue of bankruptcy for far too many people. And so many people across this country lost their healthcare because they lost their job, which is not right. And in our last budget, we fought to expand access to thousands of Wisconsinites by investing and improving in our healthcare system for everyone. But now with the Badger Bounce Back agenda, we're building on that work so that we can not just recover from this pandemic and make our communities healthier and stronger. We want to make things better than they ever were before. That's why our plan expands Badger Care to some 90,000 Wisconsinites, offering quality, affordable coverage, and also creates a state-based healthcare system so that we can invest in affordability. And one of the most particularly exciting parts is working with the Office of the Commissioner of Insurance and the Department of Health Services to offer a public option. Now, our agenda also tackles the skyrocketing prescription drug costs, and we want to increase transparency. We want to also strengthen consumer protections and bolster the programs that support our most vulnerable citizens. And so we're calling on the creation of the Office of Prescription Drug Affordability to create oversight over the pharmaceutical supply chain. And we're also establishing a $50 copay cap to ensure that insulin is affordable. And these are just three of the pillars of our plan to make sure that we can do as much as we are able to do at the state level while we still wait for action at the federal government to make sure that healthcare is accessible and affordable. And we're working to build support for this budget. So I thank you all so much for joining us today. I thank Citizen Action, the organizing co-ops, to make sure that we prioritize the health and safety of people across this state as we should. We need Wisconsinites all across Wisconsin to stand up and fight for these priorities. We are still very much in the middle of a public health emergency. And we all know someone, unfortunately, who's had a bout with the virus, or unfortunately, someone who's lost a loved one, or people who have been close to us. But we know that better is possible. That's why we continue this fight. And not only is this one of the most important fights we'll be engaged in, this is going to be one of the most critical, because a healthy population is a productive population, and we want to move Wisconsin forward as a state. So with that being said, I just want to thank you all for being here. I want to thank you all for having me.
Thank you, Lieutenant Governor. It's so great to see you again. Thank you to all of our speakers today. And as I'm wrapping up our event today, just want to invite any of our guests to put any questions into the chat box. We'll open it up to questions in just a moment. But you know, our shared advocacy, our storytelling, our leadership, it all matters. I think, Renee, you had said this earlier about the dignity of healthcare. Everyone deserves the dignity to afford and access the healthcare that they need. It's a human right. So I'd like to ask everyone who stands with us today, if you're watching the recording, wherever you are, in whatever lane you operate in whatever community you are in, your place of business, your family, your neighborhood, please work together. Please contact your legislator. Please ask them to support the governor's budget. By joining together, when we work together, we are incredibly powerful. So we ask you to call on our colleagues, the Wisconsin legislation and legislators, to expand Badger Care and to accept the funding that our state needs so that we can not just be healthy, but so that our communities can survive and thrive. Again, healthcare is a human right. Let's get to work. We can do this. And I am just so honored to be able to do this work every day with fantastic leaders across the state in many different positions of leadership. So with that, I'm going to turn it over and we'll open it up for questions and maybe a little bit of discussion.
Hi, this is Claire with Citizen Action, and I was wondering, Lieutenant Governor Barnes, you've been a leader in health equity for quite a while now, and I know it's been one of your priorities as Lieutenant Governor. I was wondering if you could tell us a little bit about some of the health equity initiatives that are in the governor's budget proposal.
Yeah, some of the most important health equity initiatives in the governor's budget, like I mentioned, was the affordability of prescription drugs. And also not just the expansion of Badger Care, but working with the Office of the Commissioner of Insurance and the Department of Health Services to create the Badger Care public option. There's also the Healthy Women, Healthy Babies initiative. The list goes on, but I think that those are some of the most important. As we know, there is an infant mortality crisis, a maternal mortality crisis as well in this state, and it particularly impacts lower income and communities of color, which is one of the biggest issues of health equity. And also, I mean, we look at how the virus ravaged communities, and we know that each community was not impacted the same by COVID-19. So continuing the work that we've been doing there to provide relief for families. And also, you know, this isn't particularly a budget item, but I do want to make a plug for vaccines because they are out there. And if you are able to get one, we are encouraging all eligible people in the state to please take advantage of the vaccination opportunity. We're doing pretty good right now, but we still aren't where we need to be. Our neighbors just to the east of us in Michigan are not faring so well when it comes to virus spread, and it seems like they may be entering another wave, and we do not need that to be the case here in Wisconsin. But we do share a land border, so it's something that's on my mind right now. But as far as the budget goes, I think one of the most exciting things should be the fact that we are working to create that public option, which will mean so much for so many families until we get some form of universal health care federally.
Hey, Claire, can I jump in for a second as well and add something here? Thank you, Lieutenant Governor, for that response. And one of the things I wanted to mention today that I love about this budget, and you all call it connecting the dots, and really it's a more, you know, plain language way of talking about intersectionality, right? To me, what was so exciting about the budget was seeing the way that you wove the narrative of how everything is connected, right? Because healthcare and health equity and health outcomes are obviously, as we're here today to talk about healthcare and access to medicine and preventative care and so forth, but it's also connected to housing. It's also connected to clean water. It's connected to good public schools. It's connected to, you know, living wage jobs. It's connected to transportation. It's connected to, you know, being able to collectively bargain in your place of workplace. And the way that you all put together the budget to tell that narrative that it's all connected, I thought was beautiful. Because when we think about the deep inequities that our state is facing, we have to understand the whole scope of the issue. And I think too often in government, we sort of become siloed, and there's sort of a good way of operating that in that way. But when we see that it's all connected, we can move everything in that direction. And that's really when that significant change, I think, we'll start to see, not just in the data, but also in people's lives every single day.
And I have a question for our elected leaders. You know, I've called my representative, John Mako, many times asking and urging him to support a Medicare expansion in Wisconsin. And he's been very hesitant, and his colleagues in the Republican Party in Wisconsin have been very hesitant about taking this expansion. I'm wondering, has there been any signals that their position is changing after the pandemic and after the American Rescue Plan? Should I keep calling? Is there hope? Please tell me.
I'm happy to answer that, Renee. And I guess I'll caveat that with saying that like the ACA battle, this is a long battle for Wisconsin, unfortunately. Even recently, with the knowledge that we would be receiving an additional $1 billion over 2 years due to the the federal economic stimulus package, Robin Vos is on record of saying no amount of money would get him to change his mind. So the head of the Republican Party is dug in on an ideological reason that we don't actually know. But his caucus is a little bit more flexible. So it's going to take some courage from the Republicans to go against leadership on this. And I do think appealing to the financial aspect of this, I've always found that if you can't find somebody to expand their heart or understand what something might have, for me, what would be a moral impact, taking a look at the fiscal or economic impact is sometimes a more practical way to reach these people. So I would continue to do that, but I would also recognize that, and Renee, you're more familiar with this than just about anybody, is that all of this is really linked to FAIR maps. I mean, it is linked to the fact that we have legislators in districts where they know that they do not have to listen to the will of the people. They don't have to vote the way their district would like them to on incredibly strong, important issues like healthcare, because no matter what happens, they will win in the next election. So again, the intersectionality of so many things in the budget. One of them is make the ability to secure maps where we have an actual fighting chance for a Democrat to win a seat and move forward with some of this legislation.
And if I could just chime in, because it's important that you mentioned fair maps, I just want to couple that with the fact that this is incredibly popular with people all across the state. There are very few things that have been this popular. I know what media market we're in, so save for the Green Bay Packers, this is one of the most popular items that could be even presented to the state legislature. It doesn't make any real sense that they haven't done it. Also want to add the fact that I want to say there are maybe 12 states right now who haven't expanded their Medicaid program. And I want to say 2 are quite possibly on their way to doing so, which would leave us in the final 10. And that's not a place that we want to be. We can do so much better.